No cancer is like another. There are many different types of cancer, and even when it's the same type, the disease progresses differently each time. That's why there are also different types of surgeries that help fight cancer. For example, the type and location of the tumor determine which treatment the doctor recommends and how everything develops during the course of treatment. And that's exactly why I'd like to give you an overview today of the different types of tumor surgeries in children and adolescents. There will also be a separate video for each individual surgery, so you can take a closer look at those as well. So as soon as you know exactly which surgery your child or you as a teenager will have, you can watch the video about that specific procedure to be prepared. So let's get started. At the very beginning of treatment, a biopsy is performed in many cases. Biopsy. What does biopsy actually mean? Biopsy is a term that is very common in medicine, as biopsies are performed in all kinds of areas, including in adults. During a biopsy, the doctor takes a sample, just a small sample, such as from a tumor or from tissue that might be a tumor. This information is sent to the lab, and they report back what exactly it is. For example, whether it's cancer and what type of cancer it is. This information is needed by the doctor to create the optimal treatment plan. All right, let's continue. Implantation of a therapy-facilitating catheter. I'll say it again because it's really complicated. Implantation of a catheter that facilitates therapy. In simple terms, this means a tube is placed inside the body and connected to a blood vessel. This might be necessary, for example, to administer chemotherapy or if blood needs to be drawn frequently. I'll also explain more details about this in a separate video. The next point is tumor removal or tumor reduction. The technical term here is what's called a tumor resection or partial tumor resection. This means that the tumor is removed entirely in a resection or only partially. This surgical procedure ensures that the tumor is either completely excised or only a portion, if a complete excision is not possible. I can understand that for you as a teenager or parent, this step in cancer treatment brings a lot of hope. But you need to know that even if the tumor can be partially or completely removed, it doesn't always mean a cure for the cancer. In many cases, the surgery is just one piece of a larger treatment plan. Whether chemotherapy or radiation is needed before and or after the operation depends on this overall treatment plan, which is created individually for each young patient. The following points are therefore important, and you should discuss them with your doctors. First, what is the goal of the surgery? Is it the complete removal of the tumor or perhaps initially just a reduction in tumor size? And second, what does this overall treatment plan actually look like? In other words, what is the big picture plan and what can we realistically hope to achieve from it? One way or another, a tumor surgery is a major and important step in the treatment, moving in the right direction. During the consultation, don't hesitate to ask questions multiple times until you're sure you understand what role this surgery plays in the treatment. I know, that was quite a lot of information now, but you can always watch the video again and again. And don't forget, feel free to ask the doctors again because it's really, really important that you understand everything. After all, it's quite complicated. No one understands all of it on the first try. The doctors know that too. They will explain everything to you in detail and as many times as needed until you truly understand it.